Hello, I'm Dr. Deborah Brayboy with Anchored Hope Counseling. Thank you for stopping by our YouTube page called Hope Talks. Please stay tuned for our upcoming episode.
Hey guys, my name's Lori and I'm a therapist here at Anchored Hope, and I've got Marcia McGlone here with me today, and she's a psychiatric mental health nurse practitioner who also works here at Anchored Hope. We are so thankful to have Marcia because when we as therapists identify that a patient or a client might need med management, might need to possibly tweak their medicines, that type of thing, we can now send them to Marcia, who does an outstanding job. One of the things we're going to discuss, or the thing we're going to discuss today for this segment, is depression. And that is a big topic. That is a topic that more folks than you realize probably struggle with. And so let's talk about depression a little bit and kind of what we see in clients that come to see therapists, come to see you. What are some of the things that you look for when you are thinking that a person might have a diagnosis for MDD, which is major depressive disorder?
Well, sometimes people come in and they will have different symptoms and they will not say, I'm depressed, because a lot of people don't realize that they are depressed. They'll have trouble with sleep, trouble going to sleep, staying asleep. They will have trouble with just paying attention to what's going on in their surroundings, and sometimes you're not able to concentrate very well. You can't stay on topic. Also, you can become irritable, grouchy, don't want to be around people. You'd rather be by yourself sometimes. You want to isolate. We also look at, are you becoming hopeless? Do you feel helpless? Are you feeling empty inside? Are you having thoughts of hurting yourself? And so we always have to ask those questions, because suicide is such a horrible end to a great life. And so we always try to prevent that if it's possible.
Absolutely. And what I've found in the clients that I've seen here at Anchored Hope is that suicidal thoughts are more prevalent than one might think.
Yes. Suicidal thoughts, I'm not going to say it's normal, but a lot of people have what's called passive suicidal thoughts, where it's just better, I don't even know why I'm here, why I just run off this bridge, but when you start planning, and thinking, maybe I just shouldn't be here. Everybody would be a lot better off if I wasn't here. My mom wouldn't have to worry all the time. My dad, he's spending way too much money on me. I'm just loafing around the house. I have no hope for the future. I think I'll end it, and you find how you're gonna do it. When you start doing that, that's a big red flag. You need to have that treated immediately.
Absolutely. There are hotlines available. The folks here at Anchored Hope will help. There are lots of ways that you can get help immediately if you have those thoughts and those plans. It's a permanent solution to a temporary problem, and the problem that you have can be solved. So just know that there are plenty of folks out there to help you get you where you need to be. As far as suicidal thoughts, you mentioned, what word did you use for passive suicidal thoughts? So those passive suicidal thoughts, as I mentioned before, are actually more prevalent in folks than one might think. And those aren't any fun either. And so I would say that if as I talk to my clients and I realize that they do have those fleeting thoughts, for me, that's a good sign that they might be struggling with major depressive disorder.
Yes, and there's different kinds of depression. Well, clinicians always go through the DSM-5 now. And so there's specific criteria that we have to go through. So there's major depressive disorder, and then there's recurrent, and then there's chronic, and then there's acute, and there's mild and moderate and severe. So we go through all those trying to figure out what is going on. So it's a lot of different types of depression. And there's also a cyclothymia, where your mood just goes up and down. Then there's dysthymia, where your mood stays down. A lot of people are just down. They're just down. And that's called dysthymia. And it has to be around for about 2 years before you're diagnosed with that.
Okay, so it's a very intricate process as far as the diagnoses go.
Yeah. Trying to figure it all out.
So we talked a little bit about medications earlier, and we did hit on antidepressants earlier. What would you say as far as if someone were to think, man, I think I do have something like major depressive disorder that needs to be treated, but I'm just not sure about getting on medications? What would be your response to that as a prescriber?
Tell them, let's start with counseling. Let's go talk to a counselor and see what is actually going on and what makes you think you're depressed. So I go through all the criteria again, what makes you think that? And medication, so then you have to talk about the risk and the benefits. Some of the benefits are your mood's gonna improve and you will feel better or more like talking to people, and you can be a better parent, a better child, a better, mother or father, co-worker, or just a plain worker. Your life will improve usually when you have a major depressive disorder and you take your medication and you adhere to your medication regimen. That's a big thing too, is adhering to it, because a lot of people that are depressed, they don't want to take medication. Why? It's not going to help. I'm so low, it's not going to help. And that's when you start thinking maybe you should go to the hospital. Or are you having thoughts of hurting yourself?
Right. So, one other thing that I'm sure to tell my clients after it, if they have concerns about starting medication, they don't necessarily have to be on antidepressants forever, correct?
No. Usually I tell them, we try for 6 months. Take it for 6 months and then we'll slowly back off of it and see how your mood is. Usually if the mood goes down or you can see a significant decrease in their mood, then we try to go back on it for at least 2 years. And some people, I have patients that have been on antidepressants for over 20 years, and they find the benefit of taking it is worth it. So yeah, it can be a long process or a short process. It also depends what's going on in your life at that time.
Absolutely. A lot of it, and I'm glad you brought that up, there is the situational depression, which it's going to happen to all of us as far as when there's a major loss, or whether it be a job or a loved one, or COVID has definitely been a situational a trigger for all of us as far as that goes. So to Marcia's point, especially if you have a situation, if your depression is caused by a situation, you don't necessarily need medication. Therapy might be all you need, or maybe you do need a little bit of medication just to kind of get you back, just to kind of reset and get you back where you need to be. And then upon that, when you do get back where you need to be, you don't necessarily have to stay on the antidepressant. So this is all very individualized. We have our things here that are typical and kind of our guidelines that we use as far as providing therapy or providing med management. But just know that we also realize that this is a very individualized business, and we all take a very individualized approach with our treatments. So.
Yes, I think that's great, because at Anchored Hope, we always do the individualized treatment.
Absolutely.
And there's one good thing about it is because it's so individualized. It's not get in, get out, we'll see you in 3 months. It's individualized. So that's a great thing about working here.
Absolutely, absolutely. And to the best of our ability, we will provide and make suggestions that are aligned to your situation. And so hopefully help get you back to where you need to be, living your best life, being that great parent, coworker, child, student, whatever it is that you want to do. So thank you very much for joining us. Thank you, Marcia, for your outstanding contribution to this discussion. And we'll see you next time.
I'm Aria. Please like this video and subscribe to my Mommy's YouTube channel and click the bell to be notified when my Mommy posts a new video. Bye.